So we are excited to welcome back Dr. Laura Sarbu.
I'll be talking about blood pressure, hypertension, and respiratory illnesses. And just my background very briefly, I'm an internal medicine physician as well as preventive medicine physician. Whenever I talk about health and the body, I like to try to explain it in ways that maybe we can kind of see in our own lives. So for me, like the cardiovascular system, which is the fancy medical term for the heart and the arteries and the veins in our body, or the blood vessels in our body, specifically arteries and veins, I kind of like to think about it as the plumbing system in our body. So if we just think of our home with the pipes and the water and things like that, and that'll be useful for when we talk about some conditions in just a couple slides. So as you can see in this diagram on the right side, we have the heart in the center of our chest, and then we have the arteries, which are these red squiggly lines that take the blood in the heart to the rest of the body. And then we have the veins, which are the blue squiggly lines, bringing that blood back to the heart so that that cycle can repeat over and over and over again for our entire lives, essentially. And that's the cardiovascular system, or like I said, the plumbing system in our body. And so when we think of the plumbing system, just even in our home, and we kind of think of, like the good, the bad, and the ugly, like the situations we want to avoid, we can think of it as when there's too little pressure in the pipes. So for example, there might be a blocked pipe or something else going on, or too much pressure. So talking about that first example, if we're in our home and we want to turn on the faucet or turn on the shower and no water's coming out, that's not a good situation, right? Like we kind of need water to go about our lives in the same way that we need the blood to get to all parts of the body all the time. The other example, which is too much pressure in the pipe, so say maybe the pipes froze or they just burst and there's water leaking everywhere in our bathroom or our ceiling or what have you, like also want to avoid that situation in real life. And similarly, we want to avoid having too much pressure in the arteries and the veins in our body, particularly the arteries, but in the blood vessels in our body essentially. And we'll be focusing more on this side of too much pressure because the similar side of that in our body is when we have high blood pressure or hypertension. If your blood pressure is too high for too long, and we're talking about typically a lot of these conditions come from when blood pressure is high for years and decades. There's other conditions that can happen if someone's blood pressure like shoots up really fast, really high, very quickly. But these conditions are more so related to hypertension or high blood pressure for a long period of time. So starting from top to bottom, if we think about the blood vessels in the brain, like the pipes in the brain, if those pipes either get blocked or they burst, that's a stroke, essentially. We really want to avoid that condition if possible. And high blood pressure or hypertension is a risk factor to potentially having a stroke. Vision loss. So the blood vessels in the eye, the arteries and the veins in the eye are really delicate and fragile. And so if that pressure is really high for a long period of time, those vessels can be damaged and it can lead to vision loss. The heart, or like the pump really working hard to get the blood everywhere in the body, if there are some of those blood vessels around the heart that can be blocked, that can lead to a heart attack. The pump similarly is working hard every single second of our lives, but if the pressure in the body is really high, then the pump or the heart has to work extra hard to get that blood where it needs to go. And after a certain point, the heart might just tire out and fatigued after working so hard for all those years. And that, in essence, is a version of heart failure. The kidneys are really important to the body as well. They help filter the blood, they help control blood pressure in the body. And so high blood pressure to the kidneys over long periods of time can cause kidney disease and eventually kidney failure, also something that we want to avoid. And last but not least, sexual function depends on adequate or good blood flow. And so if there's not good blood flow to that area of the body for both males and females, one can have sexual dysfunction. And these are the main conditions that we can see related to high blood pressure for long periods of time, but there are other things that can happen as well. And so this is why probably any and all doctors that you've encountered, there was probably like a blood pressure that was checked at that visit. Primary care doctors are really focused on blood pressure, heart doctors, kidney doctors, everyone's focused on blood pressure. And this is why, because it can lead to so many issues down the line. And we really are all working hard to help as many people as we can, help each other have our blood pressure in a normal range. So speaking of that, like what is normal blood pressure? Blood pressure that is less than 120/80 is considered normal blood pressure. You're also probably familiar with seeing these two numbers, like a number over another number. It can get confusing to think about the details, but very briefly, the top number is related to the heart, the pressure when the heart is pumping that blood to the rest of the body. And the bottom number is when the heart and the cardiovascular system is receiving blood from the rest of the body. So that's just what it's related to. you if you wanted to know that extra bit of information. But if not, you can just think of it, there are two numbers, and typically normal blood pressure is lower than 120/80. Obviously, if we're just talking about the normal, we want to talk about, hypertension. Hypertension is blood pressure that is higher than 130/80 two or more times. So that blood pressure measurement that was above 130/80 happened on two separate days or on two separate occasions, and that can be, someone can be diagnosed with hypertension. I do have an asterisk here that although that's what's typically viewed as the cutoff for blood pressure, and so if someone has high blood pressure, we're going to try to bring it down below 130/80. But for some people, that goal blood pressure may be different for various reasons, whether someone's age, if they have other medical conditions going on. So it's really important if you're someone living with hypertension, or if you're someone who may be at risk of having, or, on the borderline for hypertension, to talk to your primary care doctor to find about your specific goal, because it's not a universal goal, but it's the goal for most people. I also wanted to focus this talk on some things that one can do to improve blood pressure, and the focus of this talk will actually be on nutrition, which is a very broad topic, but we'll try to have a short conversation about it. But other things that one can do to improve their blood pressure is, if you're smoking, it's important to quit smoking. I mentioned the nutrition. It's also important to try to limit salt intake. If you're prescribed medications from a clinician to try to lower your blood pressure or keep it in more normal range, it's important to take those medications. The medications do work really well. If you're having any issues with those medications, it's also important to talk to your doctor, because there are many different kinds of medications out there, and they can be switched to something that might work better for you. If you're drinking alcohol, it's important to limit alcohol to what's recommended for people, which I won't go into the details of, but just very briefly, like 1 serving of alcohol a day for females and maximum 2 servings of alcohol a day for males. There's more details than just that. And last but not least, it's important to be physically active and to reduce excess body weight if that's applicable. And if we think of like a 9-inch plate, and the way to kind of set up that plate to have a healthy, nutritious meal, like half of it was rice and grains and potatoes. Like that was the foundation of the food pyramid when I was like in elementary school. Nowadays, it's actually been shifted, and vegetables are the foundation for a healthy meal. So as you can see, it's recommended for like a typical plate for half of it to be vegetables. A quarter of it can be grains, rice, potatoes, bread, starchy food. And then another quarter of it can be protein from sources such as meats, dairy, cheeses, beans. And so I think it's just an important framework to keep in mind when we are having lunch, having dinner. This applies to breakfast too, actually. But I do want to say 2 things. One thing is that unfortunately in this country, it's very hard to access the healthy, nutritious food that we need to, be foundational to our meals. And the second thing is that if we were to go to a restaurant, like I know if I go to a restaurant, I order a meal, the default is to have a lot of grains and have a lot of starch in our meal. Like for example, half the plate is rice and beans. And it's not typical to have half the plate automatically be vegetables. You kind of have to ask for that, or switch things out, or maybe pay a little bit more. And so I acknowledge those things that can be barriers to eating in a way that can be healthy for us. Relating to hypertension specifically, there is a diet, which I don't like the word diet because that makes me think of eating a certain way for several weeks or several months to try to maybe lose weight or do other things, and then to go back to the way one was eating before. But the DASH diet, which DASH stands for Dietary Approaches to Stop Hypertension, is not a diet in that way. This is recommendations on how to eat and what type of nutrition to take in order to lower one's blood pressure. And this is a way to eat for the rest of one's life. Like it's just important to try to eat this way as often as possible, as often as feasible. So what the DASH diet is made up of includes a foundation of vegetables, fruits, whole grains, eating chicken or fish as the main meat or, protein source. These are called lean meats, or, meat that's not really fatty. Dairy intake to be low fat dairy, like 1% or 2% fat. Using vegetable oils such as olive or avocado oil for sauteing and cooking and roasting. And eating nuts as a source of healthy fats, and eating beans and legumes as another source for like feeling full and feeling satiated. If someone's living with hypertension, they want to know more about this DASH diet, you can look up recipes like DASH diet dinner recipes, DASH diet chicken recipes. That will let you find recipes that use this framework to create a healthy meal that can help lower blood pressure over time. Another concept that I want to bring up related to nutrition is this concept of unprocessed and processed foods. And so when one thinks of unprocessed foods, you can think of food that we can just get from the earth, like from a tree, from the ground, from an animal, just as is essentially. And maybe something that we can't like make at home even. For example, an orange, you can just pick an orange off of a tree, you can eat it as is, it's not processed in any way. And the other photos that I have here on the center and the right side are just examples of if we take something that's unprocessed and move it more to a processed state. And that includes, for example, if preservatives were added, if that food had sugar and salt and other things added, and whether most likely that food was changed so that it can be on a shelf in a supermarket for a long period of time before going bad. Unfortunately, as food becomes more and more processed, they tend to become less and less healthy, and they tend to become less filling. And so it's normal to eat more and more of that food just to feel full. So for example, I mentioned the orange, but that can be an orange in a can, and there can be syrup and other things in it, or potentially a little more processed, but not necessarily, like orange juice, which can have other things in it as well so that it can stay on a shelf for longer. A piece of meat can just be as is, or it can be put in a can with preservatives, and it can be further processed as sliced deli meats. Last but not least, oatmeal and flour. There's a little bit of processing that's done to like remove that from grains and things like that, but it can also be combined with other ingredients to make bread, and even further processed to have like donuts and cereals. With this concept in mind, I like to frame it as in really focusing on, if at all possible, I mentioned before, I know some of these foods can be very expensive in their more unprocessed form than their processed form, but if we are able to prioritize and gain access to unprocessed foods, then we will naturally be actually eating less of processed foods, because these foods are very filling, they're very healthy, nutritious typically, and so that'll help us eat a more nutritious like spectrum of foods as well. The last two things that I'll bring up, one of them is actually how to measure blood pressure. It's not talked about as much as it can be, I think, with the general public, with people in the community, because if we're able to measure blood pressure accurately, then we have a better sense of where someone is with their blood pressure goal and where they might need to be at goal. So before taking one's blood pressure, it's important to try to avoid caffeine, smoking, and exercise 30 minutes before measuring your blood pressure. It's important to wait at least 30 minutes after a meal. If you're on blood pressure medication, measure the blood pressure before you take the medication, for example, but it's also fine to take it at different points of the day. If you have a full bladder, it's good to try to empty it beforehand, and then finding a quiet place where you can sit comfortably for like 5 minutes without talking and things like that before taking your blood pressure. When you actually take your blood pressure, it's good to sit in a chair where your back can be supported, your feet are flat on the ground, your legs are not crossed, your arm is supported by a table with the palm facing up, and the upper arm to be at the position of the chest or where your heart is, and having no clothes underneath the blood pressure cuff. If you were to take your blood pressure at home or go to the pharmacy and try to take it if there's like a booth there, to do one's best to try to do as many of these things, which will eventually become routine, so that you can get as accurate of a measurement as possible. And now connecting it to our focus on respiratory illnesses and vaccines, some data show that hypertension may increase the risk for pneumonia and other respiratory illnesses. However, what we definitely do know is that some of those conditions that I mentioned earlier on that can happen from hypertension, uncontrolled hypertension, such as heart failure and other heart diseases, those definitely increase the risk for pneumonia and other respiratory illnesses. So if someone is living with heart failure, then it's a strong recommendation for that person, for example, to get the vaccines against pneumonia, to get the vaccines against COVID, things like that. Hypertension can also be a symptom of long COVID. Hypertension can be a risk factor for a lot of different things in the body, and hypertension can be something that can be prevented and can be controlled to prevent all those things from happening, including respiratory illness. That's the reason why so many people in the health field are really focused on blood pressure and checking it and making sure it's normal for many of these reasons. I know it can be a little overwhelming to think about numbers and blood pressure goals goals and nutrition and all these things, but I really want to take a step back and focus on why is your health important to you, whether it's to be able to spend time with grandchildren, children, family, to be an active member in your community, to lead a physically active life. Those are the values that really can be motivating and important to keep in mind when it can be very easy to be lost in these numbers and these goals, like I said. And when you have these values at the front and center of why you're living the life you want to live, then it can be sometimes a little bit easier to include maybe a meal that can help lower blood pressure, or, to take medication related to blood pressure if one's prescribed that, for example, because that North Star is still there, helping us realize why our health is important to us.
Is there anything about hypotension? So hypotension would be if there's not so much pressure, low pressure as opposed to high pressure. Is there anything to worry about with that in relation to respiratory illnesses, or is it more that we're focused on hypertension and the risk factors there?
It can be dangerous on its own. Not having adequate blood flow to all these important parts of the body can cause damage. If that low blood flow leads to heart conditions like heart failure or a heart attack, even like low blood flow can possibly lead to a heart attack in some cases, then that person can be at risk for the conditions that I just described. That if someone has heart failure and other things, then they're more at risk for pneumonia. So it's part of that. It's on that spectrum, but there's some intermediate points between. As far as I know, just low blood pressure on its own, if someone faints or something, wouldn't necessarily lead to higher risk of pneumonia, for example.
Gotcha.
Hypertension being just such a common chronic disease that a lot of people have, having low-ish blood pressure on its own without any symptoms or anything else. Some people just have that, especially a lot of athletes can have lower blood pressure, but it's hypotension when it's getting really low or actually causing symptoms. So that's something to talk about with your doctor. There's not necessarily such an association with respiratory illness as far as we know on its own, but it's something that respiratory illnesses can also cause hypotension in the hospital and all of that. Our body kind of reacts to infections and diseases in different ways. It's something to be aware of.
Do you have any advice for someone who may have not had hypertension prior to COVID infection and then finds that it's something that they're dealing with after having had COVID? If there's any tips that you could give for that.
My understanding is that in some ways, fortunately, some of the symptoms of long COVID we would manage and treat similar if someone had those symptoms just on their own. So if someone unfortunately has hypertension and they didn't have it before, or as they're experiencing long COVID, the approach to managing it would be similar. Potentially prescribing medications if that's relevant. It could be maybe doing some of those things, those non-medication things that could be helpful to lower blood pressure. Like I mentioned about the nutrition side, limiting salt, things like that. Of course, if someone's able to exercise with long COVID, I know for some people that can be not helpful in certain situations. So some of those things do apply as if someone just had hypertension, and some of those things we just have to keep in mind whether to recommend or not recommend because that person is living with long COVID. But on the whole, it's possible to manage and to treat whether someone has long COVID or not.